Well, welcome into Health Talk Mississippi, a podcast brought to you by the Mississippi State Department of Health. I'm your host, Greg Flynn, and we are now entering the time where it's going to cool off. I promise you, it's going to cool off. And we enter the season where it starts to get a little cooler. You start enjoying a little pumpkin spice, and it means people spend a lot more time indoors instead of outdoors. And, well, that leads us to our big discussion today. It's time for you to start thinking about your seasonal vaccinations. That's a wide gamut of vaccinations that hopefully will keep you safe as we enter not only the fall, but through the winter months as well. We are honored this week to be joined by two ladies from our State Department of Health that know their business better than anybody. Our State Epidemiologist, Dr. Renia Dotson, and Deputy State Epidemiologist, Theresa Kittle. Ladies, welcome into the podcast.
Thank you.
Well, this is the hot time. This is kind of like your Super Bowl, isn't it, for epidemiology as we get into the seasonal respiratory problems that people have?
That's one way to put it. We'll accept Super Bowl, seeing that Super's in it.
Well, it seems like it's just the hot time for, that's when a lot of people have to start paying attention because there is so much gunk flying around out there, is there not?
Typically, as we get into the cooler months, into the fall months, that's when we start to ramp up our surveillance for flu, COVID, RSV. So, we traditionally monitor flu trends beginning in late September, early October. So yes, this is definitely the time that we're monitoring. We're looking for any sort of increase in flu activity. And so it's also the time to start thinking about your vaccinations because you definitely want to get those before we hit the peak season for those diseases.
Yeah, because it takes time for the vaccinations to actually take effect. So you need to, get it that month or so before the peak or when things really start popping.
At least 2 weeks for the flu vaccine. You want to get your vaccine. That's how long it takes for your body to start ramping up some antibodies to flu. So you want to have that response ready before we start to see the high transmission of disease in the community.
And you want to make sure that the only people at your tailgate, the only living organisms at your tailgate are people and not viruses.
Absolutely. Very, very good thought there. But it's not just the flu, is it? I mean, you guys have done a wonderful job in reporting of all you've now called it like the respiratory illness report because it is more than just the flu, right?
Yes, namely there are typically four that we really look into. That is the seasonal flu, COVID, also RSV, and pertussis. So there's kind of a quadrifecta there going on. So we're looking at more than just the flu.
Now, for folks out there, what is RSV?
Respiratory syncytial virus.
Okay.
So it can. The thing about it is that it can mimic flu, it can mimic COVID. So we kind of are monitoring all of that. We test for all of it to determine exactly if someone does become ill, what the culprit is, so we know the best treatments to use for them. And
then one of the other ones you mentioned, pertussis, most commonly known as whooping cough, right?
Correct.
That's correct.
I thought we had gotten rid of whooping cough. I thought it went away.
No, whooping cough is definitely here in Mississippi. We see cases of it every year, but we've definitely started seeing a resurgence of it beginning in 2024 and really in 2025. So as of right now, we're over 90 cases in the state, statewide, where last year we only had 49 cases reported. So we're definitely seeing an uptick in the number of reported pertussis cases. So that is a vaccine-preventable disease. So we do recommend that everyone get their initial shot or their booster shot when they're eligible to.
Well, we have to talk about the elephant in the room before we get into all of the vaccinations and the actual diseases here themselves, the infections, viruses. Are vaccines safe? That's the big topic right now is across the country right now, from Washington, D.C., filtering out to the states. Dr. Dotson, are the vaccines safe?
The general consensus is that vaccines are safe. Of course, as with any treatment, there are some side effects for some individuals, but the overall good that vaccines do certainly outweigh those the risk for the population in general. So yes, vaccines are safe.
Is that kind of like having to bang your head against the wall when you see the apprehension and maybe even what they call hesitancy by folks that don't necessarily want to believe in the vaccines anymore?
It's frustrating, particularly in cases like pertussis, where it's totally preventable by a vaccine, and some of the outcomes and the risk of it, particularly to infants, is so great and so phenomenal. Yes, that does get frustrating. However, if you are a person who has had an adverse reaction to a vaccine, then the risk of that vaccine, the complications of it, is 100% for you. So we can't not look at that aspect as well. We do have to acknowledge that they do occur. So I think you look at it from the broad lens of it, but definitely what is most concerning is when the information that the person is consuming does not contain all factual information such that they can make good decisions for their families and the best decisions for their families about what's right for them when it comes to a vaccine. But certainly all of our data and we've had years and years of data suggest that vaccines are safe, and they definitely help to keep us safe. And we saw that in COVID. We see it with things like pertussis that before were not a problem, but now are a problem. And that part gets very, very frustrating, because when you're seeing a child struggling to breathe from something that we could have completely and totally prevented, then yes, it does get very frustrating for us.
Well, and Theresa, you do a good job of tracking, exemptions that people seek. These are all optional vaccinations. Your seasonal vaccinations are all optional. Is that correct?
Yes. Your flu, COVID, RSV, which RSV you only have to get typically once as an adult, but your flu and COVID, you do want to get those annually, but they are optional vaccines to get. They're just highly recommended. Yeah.
So the question about opting out, one of the things I hear from people, and whether it's in close circles or you hear people talking about it just in the general public, oh, well, I got the flu shot and I still got the flu. Or, I got the COVID shot and guess what? I still got COVID. So what was the point of me getting the shot?
Well, in most cases, for the people who do contract the flu or COVID after having received the vaccine, the prodrome of the disease for them, the whole process tends to be less involved than if you had not gotten the vaccine. So it does give you some protection, and that can lessen the severity of the disease when you do get it, and therefore decreases some of the mortality and morbidity from the disease itself. Morbidity meaning the number of days you're out of work, the amount of time you're away from your family, or the things that you like to do. And mortality, of course, means that it decreases the number of deaths that we get from that. Now, having said that, I want to circle back to something that we talked about with the flu and COVID vaccine. You made a point that they are not mandatory, that you do have a choice in that, but they are recommended. And even in the new ACIP guidelines that just came out in June, the committee did vote that children less than 18 years of age should have the flu vaccine. They did make a concession in that it should be a single vaccine, and it also should not have a certain preservative in it called thimerosal. But even with the new ACIP guidelines, it is still recommended that children under 18 years of age receive a seasonal flu vaccine, and that pregnant women receive a seasonal flu vaccine.
Well, I think you guys made a very interesting point, and it's one that needs to be reiterated is that it won't necessarily keep you, certainly, from getting the flu. It won't keep you from getting COVID. It won't keep you from getting RSV, perhaps, but it will more than likely keep you out of the hospital and certainly out of an intensive care unit, right?
That's correct. It has been shown that receiving your vaccines can lessen the effects of the disease, once you're infected or if you become infected. So, it's been shown that with the data that numbers, hundreds of thousands of hospitalizations have been avoided and deaths have been avoided simply by getting that one shot for your flu vaccine. It's highly recommended, and it will lessen any sort of side effects that you may have if you do become infected with the disease.
Dr. Dotson, these days, COVID, it's still that 5-letter word that people still dread. We all dread that because we remember the height of it, but COVID has not gone away, and it is still with us, is it not?
That is correct. COVID has not gone away. It is still with us, and we're still advocating the same precautions that we did when COVID was rampant among us. Of course, keeping yourself safe, and also taking the vaccine when and where available.
It's one of those. It's hard to get the public to understand, which is why we do things like this for transparency's sake. COVID has evolved with different strains, correct? And then the longer it's been around, there is some sort of immunity that we've all built up from being around it or being vaccinated or being boosted. So that has certainly helped us as we've gone down. We're not seeing what was it called, the Delta variant?
It was the Delta variant
of COVID that was the worst. I mean, that was the one that was really putting people on ventilators in hospitals. Well, we're not really seeing a great number of that now, are we, anymore?
With COVID, we do monitor that, through syndromic surveillance. So we don't have it as a reportable condition anymore like we did during the height of the pandemic. However, we do monitor, what's going on in the community from people who present at urgent cares and hospitals with COVID-like illness. And so we do see that it tends to track along the seasonality of flu.
We get an idea of what the activity of COVID is in the wastewater as well. It does track along as Theresa said, along the lines of the flu, because it's seasonal, like whenever we're inside an enclosed quarters. And as you said, the COVID virus, it follows any other living organism's first mantra, and the first law of nature is self-preservation. So every time we make a vaccine, it gets a little smarter because it wants to live. And so therefore, it changes and modifies itself to escape the vaccines. And for the people who may be skeptical about that, well, why should I take a COVID vaccine if you're saying that it's not going to work? But it's the same that works with the flu vaccine. We take a flu vaccine every year because we look at how they work and how the flu viruses have changed themselves so that we can create a vaccine that works for them, and COVID is no different. It seems to be in some ways a little craftier these days, but hopefully our vaccines will catch up to it as well, and we'll have the same kind of results. But and then a third point that you made there is that we have accumulated various defenses over time as far as our bodies themselves having seen the COVID over and over again, and then the sheer number of people who have gotten vaccinated that create kind of a community for you of vaccinated, which creates herd immunity. I'm sure you've heard that quite a bit. So by your neighbors, your family members all having been vaccinated for COVID, that gives you a certain amount of protection as well. And we're also getting smarter with the vaccines that we make to counteract the variants. So I think all of that knowledge coming together creates a much different situation than when we were in the height of the pandemic.
I don't know about you ladies, but I remember, I get the flu vaccine every year, and some years I don't get the flu, and then other years, I did get it, but it only lasted probably 2 days with the vaccine, because I remember before I used to get the flu vaccine, if I got the flu, I mean, you're down for a week. So is there science behind that too?
There is. I mean, if you don't get your vaccine, you are more apt to have those severe outcomes, or like Dr. Dotson said, the time away from work, your time away from school, time away from doing the things that you really enjoy doing because you don't feel well enough to do those activities. And two, you don't want to infect others, while you're ill. So you're limiting, your full potential. And so, if you get the flu vaccine, you're right. You still have a chance of becoming ill, but it should shorten or lessen that duration of being away from work, being away from school, being away from those activities. And so it is beneficial to receive it, just so it does protect you, protect those around you, and then lessen or shorten any sort of side effects of the disease should you become infected, especially, not just from being away from work, but if you are more apt to have more underlying, health conditions, you definitely want to get vaccinated. So those that have diabetes or lung conditions, kidney disease, anything that could immunosuppress your body, you're more apt to have more side effects from an illness. So if you're vaccinated, you're just giving yourself a little bit more protection from having adverse events happen, like hospitalizations, like death.
And that's what we all want to avoid, right? I mean,
that's right.
Let's delay it. Let's not expedite that process.
That's right.
We don't get to pick, but we don't want to expedite that.
Besides, snow days are much more fun than flu days.
They are a lot better because you get to go out and play and those sort of things.
Exactly.
Instead of laying in the bed.
Exactly.
So when you go to get these shots, so they're all currently separate. There's no one big combo shot that's out there right now. Can you get them all at once, or should you space them out?
You can.
Yeah, you can get up to 4 vaccines at once. There has been a COVID flu combo vaccine. Last season there was. It is unclear if that will be allowed this year or if that will be made this year, since the ACIP recommendations were that that all of the vaccines be single-valent vaccines. So that remains to be seen if we'll have combo vaccines. The RSV is not really a vaccine. It's like monoclonal antibodies, and it's only given to select populations like the very young who are unable to be vaccinated, and then those who are 65 and older, so older individuals. And then the pertussis vaccine is always available, and I think that for the most part, you can get up. Most physicians will give up to about 4 vaccines at one time.
Your arm may be a pincushion, but you'll be thoroughly
you
protected.
You have 2
right?
of them.
Well, I have to. Yes, but then I have to use one to be able to work.
2 arms and 2 hips.
When you mentioned for the older adults, one of the things that at the health department we're really kind of pushing a campaign for right now is for grandparents to understand that while you may have gotten vaccinated a long, long time ago, especially now if you're about to have a grandchild for the first time, or you're going to be around new grandchildren, it may be time to get that booster or consider getting vaccinated if you never have been for pertussis.
Yes. Pertussis and several other vaccine preventable diseases as well, such as the measles, chickenpox. We recommend you get the flu vaccine, of course. You get the COVID vaccine. There's up to a total of 7 vaccines that we recommend in the grandparents package. So, the shingles vaccine or varicella is definitely very important there. Measles vaccine, I'm sure everyone's heard about all of the cases that have been happening in the outbreak in Texas. And so we're all very sensitive to that. So the best thing that grandparents can do for their newborn grandchildren is to make sure that they're up to date on all of their vaccinations, so they only bring presents when they come to see the new baby. And that goes for beyond grandparents. That goes for any caretaker or older children that are in the household. When you bring a newborn home, they should be up to date on their vaccinations as well. And if they are due any boosters, then we recommend that they have those as well.
Well, it's heartbreaking when you hear about the cases of pertussis that have come back, and that we've seen such a rise over the last year of whooping cough, as we know it. That it's frustrating, I think, to see a small child that can't be vaccinated yet, and they just struggle to breathe if they contract it.
Yes, that is one of the more frustrating things for us, because it's totally preventable. Mm-hmm. It's highly contagious, so it's totally preventable. So to bring an unwanted gift to a newborn is not something that we recommend. And so that part of it, we really, really, really want to stress that if you are going to be in contact with a newborn or a caretaker for a newborn, that you make sure that you are up to date on all of your vaccines. However, it doesn't just affect the individual who is infected. It infects the entire household, because it is so easily transmissible that anyone in the household with that sick individual also needs to undergo prophylactic treatment to prevent them from getting it, and certainly from having an outbreak within that household.
I know that so there's talk of, I don't think you mentioned it yet, but there is a pneumonia vaccine. Is that correct as well?
Yes. Yes, there's a pneumococcal vaccine as well. It's part of the grandparents package.
Part of the grandparents package. But not only for grandparents, again, is there an age range of people that should seek to get maybe a pneumonia
We usually concentrate on the immunocompromised, as Theresa pointed out before. Those people who are at higher risk, maybe on chemo, dialysis, have any number of comorbid conditions like chronic heart disease, chronic lung disease, cancer. So, we definitely lean to those individuals, and then the 65 and older age group.
You can't help. I notice the commercials all the time now for the shingles vaccine. I had no idea what the shingles was, and now at 53 years old, I'm like, my doctor has asked me, hey, do you want me to give you the shingles shot? And I had no idea how people contracted shingles. But, when I was a kid in the 70s, I guess they didn't have the chickenpox vaccine out yet. And I do remember catching the chickenpox when I was a kid and having all the scabs pop up all over my face. So if you've had the chickenpox, you are now susceptible to the shingles virus, correct?
That is correct. Once you've had active disease of chickenpox and a varicella infection, you are now at risk of contracting or developing a shingles infection. And it's not just immune to older individuals. Teenagers can have shingles. People in their 20s, 30s, 40s, it's not just people 50 and older. I've known many individuals who have had shingles, and it's not a pleasant experience. So, again, highly recommend getting the shingles vaccine as well. It may not prevent 100% from you getting shingles, but sure will lessen the duration and the intensity of it. Should you develop it. I
mean, it just looks awful. I mean, you see the people on the video.
It is not pleasant.
It just looks awful. I mean, it's for lack of a better term, it's just a big red splotches and rash. Is it a rash that comes about?
It presents itself as a rash, but it's much more painful, and it can have blisters. But the sine qua non of it is that it tends to follow nerve patterns. So people have it around like their rib cage, where it's following what we call dermatomes, but they're actually following the patterns of nerves as well. So it makes it extremely uncomfortable and in some cases very painful.
Well, you guys have educated me enough to want to get it, and the pictures I see of it on television now on these commercials, it just looks like the plague, leprosy spreading across the people's body, and it just does not. It looks awful. Like your clothes can't even touch it because it'll hurt, right?
It's uncomfortable, very uncomfortable.
You don't want your clothes touching you. You don't want sheets touching you. You don't want anything really touching your body where that shingles has developed on your body. It is a very painful experience.
This is a whole lifelong process of being vaccinated. You, every time you think you're immune to everything, nope, it's time for another one, right?
cradle to grave.
Cradle to the grave. There are things that people can do outside of vaccines, in addition to, I should say, getting the vaccines. And that's just a lot of common sense things that we talk about. Theresa, I know that, we discussed the things that you can do to keep you from.
Absolutely. Yeah, I mean, in addition to, like you said, vaccinations, just kind of go back to what we learned in school. Always wash your hands, cover your cough, in your elbow. If you're sick, stay home. If your child is sick, have them stay home and you stay home with them, or somebody stay home with them. It's just some of those common sense practices so that you keep yourself and those that you love protected from being infected. So I don't know if Dr. Dotson has other thoughts on that.
No, I think you covered them all.
Yeah, I mean, it's one of those things that they're the littlest things, whether you're just washing your hands all the time, or there's always, ever since COVID, God bless it, there's hand sanitizer everywhere. You seem to be able to go, and it's readily available, and you should make sure that you have some there, and just keeping your hands away from your face a lot. It's that little bit of effort can go such a long way.
It's interesting that you mentioned hand sanitizer because that has become like ubiquitous since COVID. However, it does not replace hand washing with soap and water. There are certain viruses and bacteria that are not cleared by hand sanitizer. So the best is to do a combination of hand washing with soap and water for, if you use the happy birthday song, or if you, what are the other songs that they tell you if you're happy, or whatever.
Yeah, you just sing happy birthday while you're washing your hands.
Right, you're washing your hands.
And then when you're done, you're done.
And that in combination with hand sanitizer is probably best. But if all you have is hand sanitizer, by all means use it. But I just want to reiterate the fact that it does not replace the good hand hygiene with washing with soap and water.
It just can't be said enough. I have a son that is in the 8th grade now, and I remember as he was growing up and he wasn't feeling well, that it can be tough on parents to say, okay, I'm going to keep you home, I'm going to have to stay out of work. It's easy to just say, okay, go to school, and then we'll see how that goes. But you don't really understand the second order effects of what you've then done by sending a kid that may have the flu, that is not feeling well, because now you're going and you've given it to hundreds of kids potentially at a school. So it's not just within your family, but now you've really helped things explode.
You've definitely, what we term those people, we give the term contacts to those people, but you've now given all of your kids' classmates, turned them into contacts. And certainly some of them, a good portion of them, will probably develop the flu or whatever illness that you may have. And then now you've got a whole classroom of kids who have it. And if you have an immunocompromised teacher, you've now made the teacher at risk for getting sick. And then, it's kind of like a domino effect after that. And voila, you have a flu day.
Well, then they're spread. The kids then go home that were in the school, and now all these other families have it, and then we have this giant flu outbreak, right?
You take it home to a grandparent that's battling COPD or cancer, so it goes beyond just our little circle.
Yeah, and then the same thing goes for us as adults. We think, oh, we can tough it out. I'm going to go to work. I'll just sit at my desk and I'll be okay. No, because you're spreading it around to the rest of the office, right? I mean, nobody wants to have to use up their sick days. They like to use their sick days when they're feeling well and they just call in sick, right? But you have to be able to stay home, get rested, so that, number one, you feel better. You're going to feel a whole lot better if you stay home and rest versus going into the office and struggling through. Because I think we've all seen that. You hear the person next to you in the office and they're just completely hacking everything up. Stay home, right?
When at all possible, yes, stay home. The easy answer is yes, definitely stay home. By all, don't go out by all means. But there are some circumstances where that may not be be just possible for you. And my suggestion in that situation is that you isolate yourself from mainstream people as much as you possibly can. Cover your cough. Wear a face covering if you have to be out to prevent the spread of droplets, from sneezing, coughing, when you can do that. But of course, the first and foremost thing you can do is stay home. If that is an option for you, then definitely do it. But if you absolutely have to go out and interact with other individuals, at least take some other precautions like face coverings, making sure that you cover your cough in your arm or elbow, as Theresa has suggested, and that you wash your hands constantly. And, you might need to hang some hand sanitizer around your necks so that you don't forget it. But anything that you can do to keep yourself safe and the people safe around you. But when possible, yes, stay home.
All right. One of the most hot topics, you mentioned it. You mentioned the word face coverings. For lack of a better term, it's the mask. Mm-hmm. What... COVID ruined that for everybody. Let me tell you right now about the mask and wearing a mask and not wearing a mask. What is y'all's recommendation? Is it just for people that are feeling ill themselves, or if you are feeling just fine and you're going out somewhere, is it, I don't want to say acceptable because you can wear anything you want anytime, right? But is it effective? When is the effectiveness, and who is the effectiveness for the mask to be worn, a mask to be worn?
All right, there are several pieces to unpack with that. First of all, it is the type of face covering that you choose to use and the fabric that it's made of, if it's a high filtration mask or not a high filtration mask. The whole point of the mask is to be a barrier. So even if you just wear a lightly covered face covering, if you sneeze or cough, it certainly decreases the amount of viral load that the next person will experience. Now, of course, at this point, a mask wearing is a personal preference. Even if you're the sick individual, you still get to make the choice of whether you will choose to wear the face covering or not. I think that it is totally acceptable to wear a face covering if that's something that you want to do and that's something that you feel comfortable doing. We have learned from the past that you cannot insist that someone wear it. We would just ask that, if you are feeling sick and you're sneezing and you have to be around other people, if you can, or if it's a choice that you can make, that you can wear a face covering to protect the other people around you, then that, I would recommend that. I think that's a good idea. So,
but the effectiveness. So if you're feeling fine, but yet it's flu season and you're going to go out to the store, you're going to be going out anywhere. Is there any effectiveness to a healthy person putting on a mask?
Well, you decrease what you're exposed to. The same. If you were to encounter someone who had an illness, then it would protect you. I don't think that in this setting now we would advocate that it has the same protective amount when COVID was rampant and we were in the middle of the pandemic and we didn't have any vaccines or anything like that. I think now if you're a perfectly healthy person, it is a lifestyle choice. It's a personal choice that you wear. And if you feel more comfortable wearing that mask when you're out, then I say go for it.
I just tell you, it's because COVID ruined it for everybody, right? I mean, when it was mandated, right? And I think that's even kept people from wanting to wear them, just because of the stigma kind of that it carries. Do you agree with that?
I don't know. It probably has affected people. I think there's two different sides of the, do we wear a mask? Do we not wear a mask? And, people may feel, targeted or, feel like they're being called out if they do put on a mask and people are looking at them. But like Dr. Dotson said, I feel like it is a personal choice. If they feel more comfortable wearing a mask and want to wear a mask, then they should feel free to wear one and feel comfortable doing so. I think it is a personal decision at this point. to help them, in their health journey.
So it's a multi-layer approach, quite literally, when you're trying to keep viruses from spreading or you trying to catch a virus. Dr. Dotson, if you could just kind of, as we kind of wrap this thing up into a bow, the biggest things you need to be vaccinated for as we enter this season of respiratory illness, what would you say?
Definitely the seasonal flu vaccine. COVID, if that fits with your lifestyle. RSV is, like I said, for older adults and children. And then we'd love for everyone to be up to date on their pertussis vaccine as we're moving into, and the pneumococcal vaccine for the older population.
If you're in that age range, hey, go ahead and get it, right? I mean, if anywhere around
Mississippi lags behind in some of our vaccinations in that age range, in the 65 and up, particularly with our pneumococcal and flu vaccines. So we're looking to increase those numbers and get greater vaccination among that population, because those are the ones who are most vulnerable. So we'd like to see if you're 65 or plus, so we encourage you to get your seasonal flu vaccine as well as your pneumococcal vaccine.
So get your vaccines. Don't be nasty. Stay home. Keep yourself healthy and cover your cough. If you are sick, just do the general things to keep you from getting worse, and then certainly from spreading it to others. I think that's the main message that we're trying to send out to people as we talk about seasonal viruses, right?
Absolutely. It's kind of that common sense approach, things we learned back in school, things that we're teaching kids now on how to stay healthy, in addition to vaccines, washing your hands, cover your cough, stay home if you're sick. And then, too, if people want more information, I think they should go to our website, look at what's going on, because we, like you mentioned, we do have the respiratory report that we put out during the traditional flu season. So if they're curious about what's going on in their community, so that they can be better informed, highly recommend that they go to our MSDH website to get more information.
Yeah, you can find that at msdh.ms.gov, and we list those surveillance reports during this time, which runs pretty much from, say, now until, what is it, March?
So the traditional time that you monitor or do flu surveillance is late September, early October through mid-May. But our traditional, typically when we see flu really peak in Mississippi is December through March. But we can see 2 peaks in a season. You can see one early and see one late. So it just depends on what viruses are circulating for flu.
Well, It's one of those things. It's the time when Mississippi, we see it spike because we're a social people, right? We're a very social state. We're very hospitable, and we like to get together for holidays. Whether it's you're going over to somebody's place for a Halloween party, whether it's college football watching or NFL watching, and then certainly as we get into Thanksgiving and to Christmas, what are some of the best ways that people can do that safely?
Well, I think we already reiterated those and basic, personal hygiene things and how you keep yourself safe from illnesses, covering your cough, washing your hands, and that sort of thing. But I wanted to expand on what you were saying, that we are social people here in the South, and that we tend to look at the holidays as starting at Thanksgiving and Christmas. However, they're called the holidays for a reason, because they start more toward the end of September. I mean, you see some of the Hindu holidays, which are Diwali. You move into some of the other holidays that are there, but it starts about the end of September, which Theresa also mentioned that you have. Sometimes we see a bimodal spike, so we see 2 spikes. It's because the holidays really, really start end of September, mid-October, and go in past January. So some of those earlier spikes could be holiday seasons where people are gathering inside for large meals and gathering. And then our traditional holidays, which are Thanksgiving and Christmas. And last year we saw a significant spike during that time. But then we had a second spike that happened at the end of January and carried over into March. So it's not just it's not just Thanksgiving and Christmas that brings us inside. There's a whole gamut of holidays that start toward the end of September and take us through New Year's Day.
We're in the South. We're Mississippians. We're huggers and we're handshakers. You guys recommend like shying away from that for as much as you can, at least during that season, or no, just be who you're going to be?
I think if COVID taught us anything, is that we have to be very judicious about about what we recommend that limits people's habits and their traditions. And so I would say that if you feel comfortable being a hugger, then hug away. If you have pause because the person that wants to hug you just sneezed and coughed and you are uncomfortable, then give him an elbow bump.
Yeah.
As a remnant of the COVID days, or a fist bump, whichever, just whatever. I think it has to be individual comfort. And we found ways to be social when we were having to social distance. So I think you can do that again, but again, it's an individual choice. So if you want to hug away, but if you want to say, hey, I think it's okay. Hey, let's step back a little bit. I think that's okay too.
All right, well, as we wrap this episode up, which I can tell you has been fascinating to me. I mean, I think it's very educational and very informative for people. Theresa wanted to make sure that we pointed out that you can get your children vaccinated at our county health departments.
That's correct. You can bring in your children, and even uninsured adults can go to their local county health departments to get their vaccines. So you can go online and schedule an appointment, or you can walk in as well.
Yeah, if you need to find your local county health department, we keep that on our website as well, so you can locate. And then you can call in advance if you have any questions. Give them a call before you even go in if you don't want to go, hang out in the lobbies.
You can certainly schedule. You can go into my chart and schedule an appointment for your vaccinations, and on any given day, or you can, as you stated earlier, you can walk in. We encourage you to download the Healthy MS app today, and then you can use the My Chart portion of that to schedule your appointment. But the even better part about that, or the added bonus to that, is that within that app is in My IR, which is my immunization record. So if you need that 121 form for school, you can download it from the app without having to go into the health department.
Excellent. And certainly it goes without saying that if you do have a regular doctor, please, anything we've discussed here today, have a discussion with your doctor if you have any questions, right?
Correct. Yes.
Dr. Dotson has seen her fair share of patients over the years, and there are no silly questions, are there, from patients?
No, the only silly question is the one that you did not ask. That's
Excellent.
The only bad question is the one that you did not ask.
Well, hopefully this episode has made people a little wiser, a little more educated, and so they'll make good decisions as we enter this respiratory illness season. State Epidemiologist Dr. Renia Dotson, Deputy State Epidemiologist Theresa Kittle, thank you guys so much for coming in.
Thank you. Thank you for having us.
All right, that's going to do it for this episode of Health Talk Mississippi, the podcast brought to you by the Mississippi State Department of Health. As we leave you now, just remember two things: get your vaccinations and cover your coughs. You can't go wrong either way. Until next time, I'm Greg Flynn. This has been Health Talk Mississippi.